Morning listeners, today we're doing something slightly different. We're going to be doing our exercises outside, so remember to subscribe and like to this channel so that we can make more videos, and please ask your questions if there's anything specific that you are wanting. Today we've had a special request to show stretches for the lower limb, and this is specifically for that numb bum and cranial nerve video that I've made earlier, but it's also anyone that's suffering from hip problems, back problems, knee problems, leg problems, the numb thigh, the calf pain, foot pain. These stretches will all help for that. So if you're a runner or you're an athlete or anything like that and you've got any problems from the waist down, then this video will be relevant for you. So first of all, you're wanting to get yourself a rolling pin. If you don't have a rolling pin, you can get yourself a little massager from Discum or Clicks. These are just little massaging tools that you can use. This one you can use, they say it's in the bath section if you're looking for it. You can massage it over your clothing like that. It works to help to release the muscle spasms in that. This feels quite nice. You would use it to massage any sore area that you have, because it's always nicer to have somebody else massage you, and here you've got two in one. You've got although you're doing it yourself, it is a little massage tool, your rolling pin, and it helps to ease up the pain. So you can roll it, you can massage it wherever you want. So if you've got the cranial nerve problems, make sure you get it in the middle of the back as well as on the side of the back, the buttock where your muscles refer to the lower back and that. And then if you've got any thigh problems, so your hamstring problems, you can do the bottom of your leg. If you've got numb thigh or thigh problems or knee problems, you want to do the top of your thigh and the side of your thigh. If you've got lifting toes or any shin splints or any problems with the lower leg, you've twisted your ankle before, then you want to do it down the lower, on the shin area here. Make sure you don't get your bone. And if you've got toes that are cramping or calves that are cramping, you want to do the calf area over there. Now you can do it on a daily basis. Don't go too hard, because it is quite painful if you go too hard, and you can actually flare the area up. So we don't want that. Right, so that's phase number one. Phase number two, or exercise number two, if you want to get yourself a little swimming pool foam noodle. This you can either cut up into sections or keep it long, because we're going to do exercises in the swimming pool that I can show you how to use a foam roller for, or a noodle for. You can use a foam roller too. I just find that if you're very painful, you initially want to start with a small little noodle as opposed to those foam rollers that are 10 centimeters or more. So that's a progression on this exercise. So what we're going to do is you start off lying on your back on the noodle. The noodle's under my buttock area here. And you just want to lie on your feel. If you take it quite low down, you'll feel it pressing on the lower bum muscles here, right in the middle on the back. And you can either roll it a little bit, or if it's too painful, you just lift up your bum and then you shift the noodle up a little bit. So you feel it pressing on there. It gets quite nicely your cranial nerve area. Now we're going a little bit higher into your lower back area. And literally, I'm doing it quite fast now, but just to give you the idea of what you need to do. But what you're wanting to do is lie on the area and feel the area subside and loosen up. And you can go quite high, you can go all the way up to your shoulder blades. It's a little bit difficult higher than that because the shoulder blades are in the way, but we can definitely use these muscles to stretch over the area. So if you've got a hunched back, or a kyphosis is what we call it in the medical term, so you look like the hunchback from Notre Dame, this is quite a nice exercise to do for your rib areas. So we're loosening up the rib areas. And if you've got stiffness in your ribs, this will also work for that. Now as we get higher, you now need to start lifting up the top part of your body. And you can see you don't have to lie too long in the area, but you are wanting to get a little bit of an effect. So you're wanting to try and relax into the area there and feel it loosening up the back. And as we go a little bit higher, then we start getting the upper body there. But you know, your whole body is affected. Even if your lower back is sore, research has shown that if you have a lower back disc lesion, 98% of people will develop a neck disc later in life. So start releasing the entire body, do a full body stretch, which is a good thing to do. Okay, so that's stretch number two, or exercise number two. Now we're going to go into the general stretches for the lower back. So if we have a look, see here, let's just start off with the buttock because I'm on the floor. You can cross your leg over like sitting in a noodle. Now a lot of people can't get into this position, so then you would sit on a rock. Look, my marvelous chair over here. So you're sitting on the chair. You can cross your leg over like this. This is a newspaper reading position. You should feel it in the hip. And then if you're not feeling it in the hip, you would lean forward so that you're feeling it stretching more predominantly in your hip. Never go into pain, just a light sensation that you're feeling it work. If you can't even get your leg up into this position, you would modify it using a step get your leg up into the step because it's not as high as if it was sitting on my other leg. And in this position, you can then lean forward, feeling it in the lower leg. You want to have your leg quite bent for this, and then you feel it there. You can use a tabletop. As you get more supple, you put it on a tabletop, but you don't need to cook sister yourself at this moment in time. You just want to generally start getting things moving. All right, so that was the first stretch, is into that position. Second stretch was that one that we tried to do on the carpet, but if you don't have movement, you're wanting to pull it up to your opposite shoulder. So we're going to lift it up there, feeling the stretch a little bit more around the buttock area here, more close to where your cranial nerve will be sitting. So you're wanting to stretch it there. Each stretch is held for 30 seconds, and you can repeat them. You only need to do it once, but if you have a specific area problem, so if your hip is a specific area, or your knee is the specific area, or your ankle is the specific area, then you would repeat these stretches every 2 hours. So you would pick the 1 or 2 that are really painful for you, and you would repeat those stretches every 2 hours. One on the one side, one on the other side. You always do the stretches bilaterally because your body will be compromised both sides. All right. The next stretch we're going to do is going to be for the hamstring. Here you'd need a little chair up, so we're going to get the foot up. I want you to keep the knee slightly bent. So a lot of people do it with a straight leg. In that position, you actually stretch the nerve. So we're going to bend the knee just a little bit, not a lot, just a little bit. And then if you stick your bum backwards, you will feel it stretching on the back of the hamstring here. Now that's a very nice stretch to do if you've had any hamstring injuries, if you've torn your hamstring. If you find that often when you tear the hamstring up at the top or it's in the middle, if you're not feeling it quite on the area that you have the pain, you'd use your hand, you'd grab the area where you'd actually hurt it, and then you would pull it. So if I've got my muscle here, I've got my hand on the other side of the muscle, and I'm pulling it like a spring. So you're pulling it to stretch that specific area. So I'm not rubbing over it. I'm pulling the muscle as if I've got the piece of rope and I'm stretching the rope towards you. So you're just going to go along the hamstring there to loosen up the area there. Again, a 30-second hold, and then you repeat it on the other side. From there, we're going to go into a calf stretch. Here you want to make sure that your foot is facing forward. You don't want your foot facing outwards. The foot must face forward. It doesn't matter what the front leg is doing. It's all about the back leg. So you're going to put your weight down into your heel. You'll feel it stretching nicely in the calf. This is an excellent stretch for anyone that has got plantar fasciitis, or if you've got cramping calves, or if you've just had a twisted ankle and you're struggling to get better from that. You want to stretch the back of your calf. All right. From there, we are going to go into a side foot stretch. So this is important for anyone that has had an ankle injury, sprain, strain, break. You need to make sure you get full range of movement. So we've got the foot pulling inwards like that. Now, you don't go into pain. You just go until you lightly feel the stretch down the side of the ankle here. This is excellent for if you've got any problems, any pain down the side of your foot, any pain down the side of your shin here, and then anyone that's had an ankle injury or a break in the ankle. Then from there, we want to get the foot upside down on the floor. This is easier to do without shoes, so make sure you're not got shoes on. And then you're going to tip the foot upside down so that you can feel it stretching on the front of the foot. Alternatively, if you've got poor balance or you're struggling to do it like that, or it's just uncomfortable for you, you can sit and pull your foot down. This again is excellent for anyone that's got shin pains, anyone that's toes are pulling up, anyone that's had a twisted ankle. So very excellent exercise to do there. So we've done the ankle, we've done the calf, we've done the hamstrings, we need to do the quads. So anyone that sits with anterior knee pain or even side pain on the side here, this is often from sedentary work. So if you're doing a lot of sitting at a desk, you're wanting to get your leg up. Now the catch with this is you need to be upright. So can you see, I don't want that position because you're not doing anything. You're not stretching anything. It needs to be level with your other leg, so straight with your other leg. And then you want to lift it up so that it's touching your bum. If you cannot reach it yourself, so in other words, you physically can't reach your ankle, you can again use a chair. You get your foot up onto the chair. Let me just show you from the side. That way. Whoops. Up onto the side there like that. And you will feel it stretching on the front of the thigh. Up onto the side. So you see I've got my leg straight with the other one. And you have it on the chair. And you'll feel it on the thigh. And then from there you can like sit down to get more movement there. I know we're getting a bending in the hip here, but at that stage your knee is probably very stiff. So this helps for anyone that's had knee surgery, a total knee replacement. If you've been sitting a lot in front of a desk and your knee is very tight, we're wanting to get that position. You can also do it in kneeling like this. So if you're wanting to and you've got stiff knees, you would just go back as if you're wanting to sit on your haunches. Again, do not go into pain. Just go till you feel a light stretching sensation on the front of the knee. Again, excellent to do total knee replacements to try and increase your range of movement. Do it on a bed so that it's not sore on the scar. And then eventually you'd want to go straight down all the way there. And you know you've got full range of movement when you can sit on your heels and your shins are flat on the floor. You can't, if you've got your feet up like that, you do not have full range of movement of your shins, and you need to fix that. So you must be able to have flat shins. You must be able to sit on your shins without pain in the knees, without pain in the ankles, and you want to do this especially quite good for people that have had ankle sprains, broken ankles and stuff like that. It takes time. An ankle sprain or a broken ankle can take up to a year to repair itself. So we're wanting to be careful on that. Now, if you watched my video of my ankle sprain that I did in February, we now a year down the line, or almost a year down the line. It's now January. So on pressure, you can see I've got full range of movement, but I can still feel my ankle. So it does take a year. It takes a long time to get it better, but don't panic. It's normal. So we're going to get it down, and then from there we want to get a nice stretch out. This helps to stretch your lower back out, and if you go all the way to the one side, you'll feel it stretching nicely on the one side of the body there in the lower back, and if you go to the other side, you'll feel it stretching on the other side. If you cannot get into this position here, you would once again do it on a chair, and here you would bend forward, you'd feel it pulling on your lower back. This is an excellent stretch to do for your lower back pain, for your disc lesions, that type of stuff. You're wanting to pull it to the one side, you'll feel it pulling on the left, and if you go to the opposite side, you'll feel it pulling on the right. Very nice stretch to do for lower back pain. Now, the other thing that you can do is we call it a Mackenzie move. A lot of people struggle to do it initially on their stomach, so we can do it in standing. And this is if you've got disc lesions, again, an excellent exercise to do, or lower back pain or stiffness where you're sitting a lot behind the computer and you've got a flat back. So a flat back is where your back is flat, you know, it doesn't have a curve at the back. So naturally we should have a little bit of a curve here and a slight curve in the upper body here, and then your neck should be seen. So if you had to draw a plumb line, it would go from your middle of your ear, through the middle of your shoulder, through the middle of your hips, through the middle of your knee, through the middle of the ankle. Then you know your posture is perfect. All right, so if you have a flat back, you would then land up with a pokey chin and a round back there, just to keep the body up straight. So to get rid of this flat back that we have here, or lower back pain, you place your hands on the top of your bum and you're just going to arch backwards. Now you don't have to lift your head back like that. You can keep your head in a neutral position and you're just going to move backwards and forwards. This is the only one we don't really hold. So we are just going to move backwards and forwards and backwards and forwards. And again, you can do this one for 10 movements. And it helps to stretch out the thigh in the front here too. And it stretches at the back, because if you've got tightened thighs, which we often see in patients that have had knee replacements or patients with lower back problems, it's going to get flexed in that position. You're going to get your flat back so that you can still keep your head up straight, and then you're going to have pain in your knee, pain in your hips, and then the people walk like this. So you'll see a lot of people walking in the shopping centers like this. They've got hip and knee problems, they've got back problems, and we need to get them back into an upright posture. So if there's any questions, please subscribe and let me know about those questions if there's specific videos you're wanting. Thanks for this video, for the viewer that asked for this. Appreciate it a lot. Hope you've enjoyed the video. Please subscribe and like again, and let me know.